in terms of from the performance aspect, and also the muscular and also the fascial relationships, do you believe from your experience that the elite performance is that a combination of, for example, like Russell Westbrook? I saw you took a photo with him on your Instagram, right? So we do work with athletes, for example, from high school all the way to Division One, right? And some of them, they're not built to be, have bulky muscles, especially in the calf area. They're very, very tiny. In fact, in certain instances, they're smaller than average. However, they do produce a lot of explosive power. Like, how would you explain that with the mainstream theory of muscle hypertrophy, and why are those people with smaller muscles are
Mhm.
able to be that explosive, you
Mhm.
know, without any type of weightlifting, like for example,
Yeah,
Russell Westbrook.
yeah. I think it's a great question. I don't know that I have, the complete answer, but I'll attempt to address it. There still has to be kind of a minimum ability with regard to the contractile properties of their muscle. So that's number one, right? Russ is very strong, works out, and you know, has really good contractile properties. But not focusing on him or any one player. A lot of this kind of gets back to some of the innate spring or stiffness kind of in their tissue that includes muscle, tendon, fascia, and so forth, and joint stiffness, and how that all kind of comes together. So there are individuals who are really good at kind of utilizing, just kind of the innate spring in their tissue so they don't have to, or they don't necessarily need to rely, kind of on the contractile properties, of those muscles. um I think that there are still skeletal architecture and joint factors, that can help an individual as well, right? We know, that joint surfaces are different for different individuals. We've got people who have shallow hip joints, and we have people who have deep hip joints, and their range of motion and their mobility is going to be different from
Yeah,
person to person.
anatomical difference.
Yeah, anatomical differences, shoulder joints, right, as well. And again, on the continuum of compliance and stiffness, if they're too compliant and have too much motion, then forces are going to leak out and they're not going to be able to generate, what they need to. And of course, if they're too stiff, that could be problematic as well. The compliant folks tend to have more soft tissue injuries. The stiff folks, too stiff, tend to have more bony injuries. So there's really a sweet spot, kind of in between one and the other, where they're kind of able to do these things. And I think there are people on the continuum, of those body types that really not only rely but excel, on some of those factors. I mentioned varus thrust. The majority of NBA players have genu varus, and we know that their valgus forces at the knee are necessary for athletic motion. So I'm not saying that they don't go into valgus, and that and going into genu valgus is a
Yeah.
necessary athletic motion, but the tendency is to kind of push off of that posterior lateral corner of the knee to generate these forces. And when I do that combined with the innate stiffness and spring in tissue, I don't have to generate a lot of contractile force to be able to propel myself forward if I'm utilizing that type of a strategy.